Welcome to the office.
Welcome to the office.
Glad to be here.
How can I help you? What brings you here?
Well, I've injured myself many years ago, probably 4 years ago, mountain biking.
Okay.
Something so simple. I had just come
What
off
did you injure 4 years ago?
my low back.
Okay.
Just by
Flew over?
Nope. Literally had finished the ride, came to the vehicle, feeling good, decided to do a stretch. And when I put my leg up on the back of the tail
Okay.
gate and leaned forward.
Right leg.
Yes.
Okay.
I tried to stretch my hamstring, and I felt it slip, and I couldn't even stand up straight after that. Literally, I was hunched over, pardon the expression, like an old man. Could not stand up straight for 2 weeks. Finally, one of the guys at work said, "Hey, you might want to go see a chiropractor." He did an adjustment while I laid on my side.
Any exam?
Well, just a visual, and
Okay.
then said, "Okay, I can help you." And where he loaded me up, he called it, "I'll load you up," popped my low back on the right side, flipped me over on the left side, did the same thing. And I literally stood up and was standing now for, and I hadn't been able to stand for 2 weeks. And so
Good.
I think that lasted for a year. And then,
Good.
then it happened again. I was in Minnesota this time, so I had to find another chiropractor. So I found another chiropractor. He did the same thing. Must have lasted another 7 months, and then now I'm in Missouri working. And I went to this guy 5 times, and every time he could not adjust me.
How long after that first incident, the 4.5 years ago, are we now in Missouri?
Yes, that's 2018
So
or 19.
2 years
Yep,
later?
19, yep.
2 years later? Okay.
And then anyway, I have been from chiropractor to chiropractor. I'm just finding whoever, and I could never get the relief that, certain chiropractors are able to do.
As you're progressing for 4.5 years,
Mm.
you were getting an adjustment, you felt good, you went on, no one ever took x-rays this whole time,
No.
and you didn't think you needed it because you had your relief.
Yes.
Okay. There's a big lesson we're gonna learn today, guys. Okay? Jokes aside.
I've been going to multiple chiropractors, and I get some relief, but then it just comes back again. So and no one's still x-raying me, and I'm not, I just don't know what's wrong with me. I just know, I'm to the point where now I've got no relief even seeing the chiropractors.
Okay.
And I'm
How'd you get
icing
to me?
it.
You got to me in the phone book?
One of the last chiropractor I've been seeing, he recommended you guys, and he
Okay.
said you're more specific. You will take imaging. You will be able to see, and work on that area specifically.
What the issue is.
Yep.
Okay.
So
Well, I appreciate it.
yeah,
I do appreciate the
I was
referral.
reluctant because I'm like, I've never heard of this. Is it
Gonstead.
Gonstead.
The
thank you.
Gonstead method.
Yes.
It's actually the Gonstead Chiropractic's 100th anniversary.
Well, he did tell me you guys are more traditional.
Old school.
Right.
So now you're
So
here.
I'm here.
And so number one complaint is the back pain and spasms.
Yes, constriction. I got.
Do you have it right now?
I can feel it, but it isn't bad. I took 200 milligram ibuprofen this morning.
Okay, no muscle relaxers though.
None, ever.
Okay, and we're going to talk about what a spasm is. And when I go over your x-rays, I'll explain the x-ray and I'll explain the symptom of the spasm, how it relates.
Okay.
Okay? I'll explain all that. Okay, all right. Anything else going on?
No.
Well, let's go over your x-rays.
Okay.
Let me explain what I see. Before I start, let me rewind. Or do we get any shooting pains down the leg?
No.
No sciatica, nothing in the neck?
No.
Okay. So, I mean, you're pretty fit. Okay, you work out. You're active.
Yes, it's been the last 2 weeks where I haven't been able to do my normal routines.
Let's get some answers, okay?
Okay.
Let's get some answers. Let's go over your x-rays.
Yep.
And we'll go from there. This is the foundation of your 24-story building.
Okay.
What you're complaining of is down in the foundation.
Okay.
Right? And when you're saying spasms, can you show me where you're getting your spasms?
All across here. Literally this area and all the way up into here. So,
But it doesn't go past there.
Maybe up to there, yeah.
Okay. So we're talking about the
It's
first...
just sore. It's like constricted, yeah.
So we're talking about the first 4 or 5 floors, let's say.
Okay.
Okay? So the first thing is, do we have a level base and foundation? And I want you to see there are a few things going on here. Whatever you were getting done, it was giving you some relief. I understand that. We do have a altered foundation. It's slightly off a little bit. And what's happened as a result, the body's trying to fuse. So if we look at 5, 5 is trying to fuse to 4. 3 is trying to fuse to 2. We're getting, if you want me to use the clinical term, it's spondylosis or arthritic bridging. As we go up, you can see, again, just compensation's going up, body's trying to stabilize. Your activity, your workouts is what's been holding you together. If you weren't doing that, you'd be in a bigger situation, okay? As you go up the spine, we start to veer to the left, and then we compensate again to the right. That's fine. We have a little jaw deviation. If you want me to deal with it later, I'll deal with it. That's not why you're here. But now I want to show you on the side profile what's going on. We are designed to have level parallel discs. Okay, let's look at the lumbar spine. Dude, this is starting to, this wants to just kind of fuse together. This is L5. This is L4. We have a black line through the disc where the disc is supposed to be. This is called a vacuum cleft sign. It means there's no movement, there's dead tissue in there. I want you to see your discs. 5, 4, 3, 2, 1. So what's happening is we don't have the right curvature in the spine. It's too straight. And so whenever you've dealt with it, again, your muscles, your core actually helped you. It's not that you have a weak core. It saved you all those times. And whatever happened mountain biking, whatever it was, started a process. But this has been going on for over 30, 35 years. Okay, this didn't happen 4.5 years ago, straight up. Okay?
Yep.
Now, as we go up the spine, these are all good here. Thoracic discs are all good. I don't think you knew this either. You have this, you have congenital fusion of C3 and C4. It's called a wasp waist. I don't like to use the word, they call it a wasp waist deformity. This is congenital fusion. So getting your neck twisted ain't going to do nothing for that. Okay, straight up. C2, C3, and C4. Now, the good news is you still have space there, whatever it is, you're still functioning, everything is good. That's fine. But all of this is a result, except for this. Don't worry, this is there, that we're born with. Everything else is a result of the foundation. So we need to look at the foundation of what's going on here, okay? So far so good?
Yes.
Okay. And then I'll, actually before I do that, let me explain how you got your relief, okay? This didn't happen 4.5 years ago either. All this was there. If we look here at your SI joints, and I'm going to zoom in, what we can see here, we should see the line of lucency all the way through. So there's a lot of scar tissue in there. So just by them freeing it up, it did give you that relief and got you moving again, and you're back working out, doing your thing. And I think you're the kind of guy, you just keep going, dude. You just keep going till enough is enough.
Yeah.
And just like you said, you're like, hurry up and let's get out of here.
Right. Constantly.
You're not hurrying up and getting out of here. I'm going to explain this to you. You need to understand it, okay?
All right.
All right, cool. Now, where did this all start? I see a tailbone injury. I see a bent tailbone here, which is probably where I would start. Because if 5 and 4 are fusing, this is according to the work too, if these are fusing, means there's been instability. And if we go through the mechanics, right,
Yes.
of the spine, and I want to talk about this. This is really important. So we are designed first to have 60-degree reciprocating curves, front of the spine, front of the body, back of the body, front of the body. Yep?
Okay.
60, 60, 60. If we lose our curve for whatever reason, slips, falls, life happens. Yep? The first thing that kicks in is the muscular system. We lose our curve, the muscles start to spasm. A muscular spasm, this is important, is the body's protective mechanism. It's a splint. So we don't want to relax this splint. Doesn't make sense. When we spasm, first thing we want to do, as we've been recommending for 20 years, ice. Across the spine, ice the area. There's instability. So if you recall back now, we don't have to go over it now, but you can recall when these spasms actually did start way back when. And whatever the process you went through. Muscles will spasm for a period of time. It is energetically very expensive. It will only do it for a period of time. The third defense, or the third mechanism, will kick in, which is the ligamentous system. The ligaments, the function of the ligament are to connect the bones. Now, follow the process. If we're supposed to be like this, we are now like this. These ligaments adapt. They adapt, they shorten. Now in this position, what happens? We're fixed in this position. So the muscle spasm, eventually fatigue, the ligaments start to shorten, they get stiff. So you wake up in the morning, I know you've had this, I've had it, wake up, we're stiff. We got to keep moving, we move, now all of a sudden we're good. End of the day, things are tight again. Make sense?
Yes.
Okay, wake up in the morning, stiff. Get on with the day, tight. Okay. Fourth defense kicks in, which is the disc. Now, the disc is a spacer. The disc is also a little bit of shock absorbing mechanism. The discs have been absorbing all this for a period of time. And then the final system is the osseous system, where it says, okay, you lost the curve, muscle spasm, fatigue, ligaments shortened, disc started to wear out, and then finally the body says, I'm going to lay down calcium. And this is our final stage of the body stabilizing. And this is so important. I want everyone to get this. I did an old video on all this, explaining all this to people over 7 years ago. Nobody watches it because it's an old dingy x-ray video, okay? But the point is, all this started from some initial injury that created the instability. And the spasm is your first sign, everybody. It's very, very important.
Yes.
So when we have a spasm, please don't take the battery out of the fire alarm. And what does that mean? We take a muscle relaxer, quiet it out, take the battery out, get on with life, right?
Right.
Does that make sense?
It does.
Whether you want to hear it or not, that's
So
what
I'm
it is.
Screwed, right?
No. I'm just saying, I'm showing you what it is.
Yeah.
That's it. That's my job. Everyone comes here first. Your guy sent you here for a reason.
Yeah.
To get an answer. Otherwise, you playing a game, dude.
I know.
And you traveling, and you're hustling, you're moving around, you're working, project. But here's the cool part. We should be able to find you somebody wherever you're going, okay, to maintain you. Does that make sense?
Yes.
It's different now. The game is different now. I'm sorry. So we'll figure out what we can this week, 2 weeks you're here.
Okay.
It's not that I'm seeing you every day, but I'll see you a couple of
Yep.
visits and we'll figure it out.
Cool.
Okay? Once I got you stable and moving and active and back to your routine, I mean, you're going to be flying around, traveling, doing
Yep.
all that stuff again. So we got to find someone close by. We do have a referral directory.
Nice.
Okay? And I'll make a few recommendations for you.
Okay.
Okay?
Perfect.
Now, let's go to the foundation and look at the foundation. You have an AS pelvis on the left side, okay? And I'll explain what that is with a slightly short leg on the left. It's only 3 millimeters. That means that this is what's happening. Your left side goes up 8 millimeters and turns slightly in. Your leg is down 3 millimeters on the left. Now, if I adjust your pelvis on the left down, I'm going to make your hip worse.
Hmm.
So if your left pelvis gets adjusted down, it
Yeah.
gets worse. Follow my process. However, it does show as a pelvic misalignment. So now, if you're getting this side adjusted and this side, you just got mobilization on both sides. That's why you got your relief. But if you were getting one side only, it would have been a lot worse. Okay? Follow my process now. Your answer is in the tailbone here. Because again, if we adjust this first, we're going to make the hip worse. And I don't adjust both sides. That's not... And let me explain why. So that's the next question that everyone's going to ask. In the Gonstead work, what he found, and in my 20 years of practice, I've had 2, maybe 3 truly subluxated fixed SI joints. One is the true one, the other one is the compensation. Now, yes, long-standing, the compensation can become a subluxation and a problem as well, but you don't do both. If they're both truly stuck, yes, there is an adjustment for it. It's kind of cool. It's a 2-in-1. It's actually really cool. Okay, I think I've showed it once. I think I've only showed it once. Okay, but the point I'm making is, my suspicion, it started on your left SI joint. That's my suspicion.
Yes.
That's the very first time.
I think that's correct.
Okay, and the reason why is we have a slightly rotated sacrum on the left. Now it's only 1 millimeter, but it's there, and it's down 1. Again, it's small, but because both of this, I'm getting the left pelvis and left sacrum, my suspicion is left side. Okay, make sense?
Yes. And
Tell me.
well, that's where the issue started, I believe, on the left side. But now it's migrated across, and now it's into this hip area, and this is the side that's giving me the issue.
Because you're compensating and you're favoring that side. Does that make sense?
Yes.
You're favoring that side because this side is stuck. If you need to get up and move around
Yeah,
at any
just
point,
sitting.
please move around, please.
Just sitting, it just adds.
So what do you do at work? You don't sit.
I do sit.
How do you deal with it?
I have to get up and do stretches.
Okay.
I'm constantly stretching.
For how many years you've been? This is before 4.5 years ago.
No, this has been, I never did any of that stuff. I didn't need to. I was very limber, I was very active. I never ever did any of that. Now, the tailbone thing, I think I know when I fell on that thing, but that was a long time ago.
Yes.
When I was a child.
Yes.
Yeah.
Okay. And I talk a lot about tailbone injuries in the last 5 years. Okay, I would say 85 to 90% of my cases, I'm starting in the tailbone anyway, because that's something that's been missed.
So, if something's been messed up for a long period of time, like the tailbone,
Yes.
is there any recourse?
Good question. I have patients, yes, I have them young, that's easy to fix. I have older patients, I mean, you can go back to my video library, that are 30, 40, 50, 60 plus, okay? So the idea, I said, is to stabilize you. My thing for you right now is that and that blackness there. That's gas, that's your stomach. But that black and that's a vacuum cleft sign. That means it's dead tissue, there's no oxygen, there's no movement. So we gotta figure out what table we're gonna use and how we're gonna get movement. Am I gonna load you up here? I don't know until I examine you. If you watch any of my videos, I'm going to try to get you on that knee chest table so we can get a nice deep set for you. Okay?
Yeah.
It's going to be a little spicy.
Yeah, I've seen
And
it.
it is what it is. Okay? It may be a little spicy. It is what it is.
Can I go work out today?
You're hilarious. Here's what I would suggest for just a couple of days, okay? You can do some hiking. That's up to you. Okay? That's up to don't injure yourself.
Okay.
Biking and hiking.
Just road bike.
That's fine. I'm okay with that.
Yeah.
If you want to strap on a backpack with some weight and do a hike, you'll get a little bit of resistance. If you can avoid all that, better. Swimming, walking, biking for now.
Okay.
Just a couple of visits.
Cool.
Let's figure it out.
Okay.
You start hitting weights and tightening everything up, you're just making my job harder.
Okay.
Fair enough?
Yes.
Okay.
Push-ups?
Body weight's fine. Yes.
Okay, perfect.
Push-ups, pull-ups if you want. If you're doing pull-ups, you need to contract the glutes, so you're using your back, you're using your lats, not your low back.
Okay, I can't do that.
Then don't worry about it.
Yeah.
Push-ups are
Yes,
fine.
cool.
Okay, can you do them now?
Yeah.
Okay, no
But
issue.
I jacked it up the other day, and so I haven't done any for like 4 or 5 days, because that's when I think I messed this up. I felt it twinge.
When you were doing a
When I
push-up?
was doing a push-up, yeah.
Okay, I'm gonna have you test, I'm gonna test you to
Okay.
do 1 or 2 push-ups
Yep.
before and then after.
Okay.
So we have something to compare to.
Okay.
Okay?
Yep.
We're clear?
Yep.
Starting at the base, and the first thing we're getting, 20 points, C1 up top. 10 points, T6, T7. So think of this like your electrical panel, or your 24-port switch, right?
Yep.
And I'm just making sure connection between here and all these ports are free. 10 points, T6, T7, left side. Now, because of the condition of the spine, I am tilting the scope to compare above to below. Sometimes when the nerve goes cold, we don't pick it up that way. His mid-back is fine. There it is. S4, maybe S5, down low, left side. S4, S5, T6, and C1. Those are the 3 spots I'm getting. Let's go ahead and examine the pelvis. Scoot forward, please. Feet together, feet touching. I'm on the hips here. I'm on the SI joints there. Open and close your knees with your feet touching. I'm checking general motion of your SI joints. Okay, do the right side only. Open wider, please. So if we have open and close, open and close. If we have fixation, then the opposite side will go with it. Keep going. So when he does that, the left does go a little bit with it. Do the right side, or sorry, the left side. When he does the left, there's nothing wrong with your right SI joint. You got it? So this was a left SI joint injury to start with, tailbone. Right side only. You feel the difference there?
Yes.
So when you do the right, you feel my thumb moving with it more.
Yes.
Do the left side. That doesn't move as much. That's more independent. Do you feel that?
I do.
Okay, I want to make sure you feel what I'm feeling too. Scoot back for me, please. Okay. Static palpation, head down. Running my fingers down the spine, looking for edema and point tenderness. There, I feel it right there. 7, 1, 2, 3, 4, 5, 6 more tender to you. 7,
Yes.
6.
6 is more tender.
6. I'm pushing harder at 7. I'm pushing harder at 5.
Yeah, nothing like 6.
Okay, let's check down low now. Come back slowly in extension. 5. I do want to talk about the curve in the spine, and we will need to deal with that left pelvis, and I'll explain why I forgot to mention it. Let's just figure this out
That's
first.
painful there.
Okay, this is 5. This is 1. This is 2. This is 3. This is 4. This is where I'm getting it. 5 on the left. 5 on the right.
Oh yeah, that feels good though.
5 on the left. Right there. Okay? That's where I'm finding it, sir. Now, sit up straight. Okay, I forgot to mention something. So, you have tailbone injury, we have the left AS ilium. We will need to deal with that for long-term stability, and the reason why is this. An AS pelvis, I'll explain it first. So, an AS pelvis, when it goes anterior superior, it goes up. The sacrum, they work in opposite like this. When this goes up, this comes back. That causes a straight spine or poker spine, we call it, right?
Okay.
Okay. When it goes PI severe, it goes forward. That person has a lordotic curve or too much curve. So the fact that yours is straighter, that AS is contributory to it. Okay? I just want to be clear about that.
Okay.
So I'll need to deal with it at some point. Come back over here. Or it will need to be dealt with, long-term stability. Okay. Come back slowly towards me. This is the top of the joint, SI joint. This is the middle of the joint. Anything spasming when I do that?
Yeah, up in here.
Up in here?
Yes.
Okay. Let's do the right side. Hands on your lap. I got you over. Top of the joint.
Yeah, I feel it now. It's just across the bottom, like the spine.
Okay. S5. S5, T6. Let's check the next. 7, 6, 5. That goes as a block. That's 2. That one right there. 1. I don't want to move. 1. I'm going to leave it at that. Okay, let me make a game plan and get started with you, sir. So if we go to the x-ray, let's get a listing of C1, T6, and we already know about S5. So his C2 wedge is slightly on the right side, C1 wedge is on the left. Okay, so if we're looking at just an A to P x-ray, so it's wedging slightly there, you can see there's some scar tissue there. However, I'm not going to do C2, and there's a reason why. If I go here, you can see C2 is anterior to 3 and 4, so I don't want to touch C2. I do need to work on his C1. And it's going to be a very delicate adjustment, C1. Okay, so we'll do C1 on the left. We're going to set C1 as a, let me go to the flexion extension. Okay, so an extension and in flexion. Let's wait on the C1. It's not moving. I'm going to do T6 first. I'm going to do T6. I'm going to do S5. Then I'm going to recheck up top if we still need to do the atlas. Okay? You ready?
Yep.
Let's do T6 over here, please. Face down. T6, we're going to set it as a PRS. 2, 3, 4, 5, 6. T6. Drop the hand, sir. I'm going to reinforce my index finger. You gotta let that go. Hold on. Gotcha.
Yes.
Give it a second.
Okay.
Just relax there. That's that nice, dude. Deep breath in. Blow it out. One more time, deep breath in. When you're ready, turn to your side and come up. When you're ready. Let's walk that out. May feel a little weird for a second.
I feel nothing here now, which is great.
It's like, all right, I'm out of here. Walk it out. It was S5.
Solid.
Keep walking.
Yeah. I feel great.
I'm joking, dude. I'm joking. Keep walking. Keep walking. Damn, we didn't do your push-up before. Keep walking.
All I care about is,
What's that?
all I care about is I don't feel no pain.
Good. Walk it out.
Be nice if it doesn't reoccur.
Keep walking.
Yes.
Just keep walking. Move it around.
Yes.
Just let it out, dude, please. Just let it out.
Yeah.
That's fine. That's fine.
Okay, this is good.
You want to do a few push-ups? Might as well. You're here. Well, you're here. If something's going to happen, I'm here. Show off. All right,
Yeah.
now you're showing off, dude. Come on.
No, that,
I'm just playing.
I do feel that
Little tiny
just
tip.
tiny bit. But
Keep-
it's probably just jacked up from being so sore for so
Keep
long.
going. Keep going. Keep going. Right on. Let's
Yeah.
read.
And I'm not trying to, I don't want to compensate, I just want to be natural, and I feel like I'm like being protective right now, so.
Are you being protective right now?
I think I am, but I don't feel like it.
Walk on your toes. Walk
Yeah,
on
I
your,
feel good.
walk on your toes.
Oh my God, I feel
Up high. Up high.
good. I can go, I could do these since I was a kid.
Walk on your heels.
I can do that.
Okay. Nothing twinging?
No.
That actually set really nice.
Yes.
Regular walking again, please. Let those arms go, brother. Let them go. Good. Come back over here. Let's rescope. Make sure we're good and see if we have to do up top. Alrighty. That was T6 and S5. Should feel different to sit now.
Yeah, it's not pinched on this side now. Oh my God. Yes.
Starting at the base. Head down, please. You need to do at least 10,000 steps today, okay? Lots of
do.
walking.
I
man.
do. Yesterday's 3 miles, day before.
Thank God that
5
cleared
miles.
your neck, dude.
Oh my God.
Good thing we didn't touch his neck. T6 is clear. Nice. Now, more important, let's feel and see what happened down low. Booyah. Clear. Now let's feel it, okay? Start at the top. L5, S1, S2, S3, S4, S5.
So when you
Little
did
sore.
4, this,
You
like the
felt it?
muscle is just, I guess it's just tired
Yeah,
from
yeah, that's okay.
being constricted for so long.
Come
Yeah.
back, come back yourself. Good. Scoot forward, let's check the movement of the SI joints. I mean, that's our start, dude, okay?
Okay.
If there was still pressure, I'd go
Yeah.
for more, but there's not.
It's just,
And we'll deal with the muscle. I'll show you what I
Yeah,
do for the
okay.
muscle, don't worry. Feet together, open and close your knees, open and close. Do the left side first only. Do the right side. It's different now. It's not moving as much, it's a little less now. Still moving a little bit, but less. Okay, now you get the buff and polish. Bear with me for a couple of minutes here. So you see when it goes over regular stuff,
Yeah,
wherever that tickly spice is,
yeah. Oh, yeah. It'll give me 15 minutes to cut that out.
yeah,
I'm serious.
not more than 5 in any given body part.
Alright.
Walk it out.
All right.
I'll give you instructions. Just make sure you're good. Just make sure you're good.
Yes. Feeling good, feeling strong.
I'd like you to do a couple more push-ups, just 3 or 4,
Okay.
okay, after the buff, just to make sure.
Yeah, no issues.
No twinge, right?
None.
Okay.
Yeah.
Now, let me tune up your other stuff. So we got some compensated ankles. Let me tune up the extremities for you. Go your back, relax the ankles. And sound is the board, not your foot breaking, okay? Relax the foot, relax the foot. Let it go. There you go. Bring that up. There you go. Sit up and turn. Let's do the shoulders. Relax there for me, please. Easy. There you go. Let me do it. Let me do it. That's it. Stand up and let's check the hands. Squeeze. Hands good. Squeeze. Tiny bit on the ulna bone, just a tiny bit. Relax the wrist. There. Squeeze. Solid. Squeeze. Tiny bit. Relax there. Squeeze. Are we clear with what we found?
Yes, very clear.
Okay.
I was having issues due to spacing in the lumbar, in the disc, yes.
And this all started from an old tailbone injury where the body compensated. You're an active guy, you dealt with it all these years, meaning you were active, you were fit.
Yeah, I tried. You know, I'm not one to just sit and watch TV, so
Good, okay.
I'm always out doing something.
I'll see you for just a couple visits, okay?
Okay.
And then we'll see how things hold.
Okay.
Ice, walk, swim. If you want to bike, it's fine. Keep the body upright. Here's the key with biking, especially with a back. You don't want to go more than 19 degrees in flexion. So upright, like cruiser style would be better, road bike, but you want to be upright.
Yeah, I'll be on the road then.
Perfect. And if you're in the chair, you don't want to recline back more than 19. That's our window.
Okay.
So let's say 20 degrees flexion, 20 degrees extension in
Okay.
between there.
Okay.
Okay?
Yes.
Welcome,
Thank you.
welcome to
Really
the
appreciate
office.
it.
You're
Yeah.
very welcome, sir.